Thank you so much, and thank you for giving me the opportunity to come here today and share some of my ideas and experiences. And I'm sitting there feeling really nervous, deliver a killer talk. It's like, oh, right, here we go. And I have a fundamental belief that as a clinician, you should always be a scientist. You should always be a researcher at the very minimum, but a scientist therefore because you're researching. If you see somebody in front of you and you're treating them, there's two approaches. There's the approach that you've been told, and then you walk away. Or there's the approach you've been trained to do, absolutely, that you've been told. But then you stop, you observe the response. You try and understand what's behind that. And I feel that you're a group of people that all have an extraordinary privilege. We've had an education and training that's got us to this stage. Well, a part of that is giving back, and a part of that is advancing the body of knowledge. And we can do it in small ways and large ways, and we do it any which way we feel comfortable with. But I put it to you that maybe a little bit smarter in doing it in ways we feel maybe a little bit less comfortable with. And it should be actually fundamental to our medical training that, in fact, adding to the body of knowledge isn't an option. It's a duty and it's an obligation. And you think, oh gosh, how did I start thinking like this? Well, I started my career in St Thomas's Hospital Medical School in 1975. I found myself in London in the swinging 70s, and it was pretty wild. It was a fantastic time. We had it was good fun. I absolutely loved my med school and my med school time. And so there I was, one of 12 women in my year, and I went into the first session in anatomy. And it's such a tragedy, they don't teach anatomy in the way they used to. You know, we got right up there and personal. We were really involved in dissecting. And there I was looking at the forearm, and I thought, oh my gosh, it's exquisite. The human body is exquisite. I should know, I've been there often enough. We're all the same on the inside, or pretty similar. And so this is well, if this is what a surgeon does, put this back together, that's what I'm going to be, day one, insight of a gnat. Right? I had no insight at all, but I'm good at making decisions. They might be good, they might be bad, they might be ugly, but you've got to live with them. Yeah? And so, right, this is what I'm going to be. I remember what I was wearing. I was wearing bright yellow loom pants, thinking I was really cool. And I came out, and I thought, oh, this is what I'm going to be. One of 12 women in my year, and I had this. There's sometimes you got your think bubble and your speech bubble, and sometimes they get kind of mixed up. And I said, oh yeah, I'm going to be a surgeon. To say, day one, and it was caused a lot of amusement around the traps. But what was fascinating to me was the people who I didn't know me, said you can't do that. And so I'd like to share with you a very valuable lesson. And that if you listen to nothing else, please remember this. Criticism without engagement in problem solving is a black hole. It will suck your energy, it will take your time, and it will give you nothing. There's so many people ready to say, no, you can't, computer says no. No. Who are you to say, without any insight, that I can't do X, Y, or Z because of the way I look, or because I'm a girl, or because of anything, really? And so I learned that lesson the hard way, and I'm hoping to give you a bit of a push forward. Don't even waste your breath. Don't even give it oxygen. Because there are far, far more people out there that when you make a suggestion or when you ask a question will engage in a say, oh, well, that's not quite right, and we did this before, but have you thought about? And that's the conversation you have. That's the one you chase down. And I was very fortunate because during my time, certainly in the pre-med area, when we did our first couple of years, I realized that I had to have a CV that was different from my mates, the guys around me, in order to even get on the page. Research suited my personality. I've always been like, why? You know, my mum and dad's like, oh, here she goes again. You know, but why? You know, have we got an explanation for that? How could we do it better? And so there I was, as I say, as a pre-clin med student, and I was already sucked in because I absolutely knew that the one thing I had to do was work hard if I was in a position to give myself the opportunity to keep going forward. And again, another lesson number 2. One is you don't engage in negative energy, and the second is there is no substitute for hard work. That was a really heavy sell. I've got half a dozen children in my house, like 4 boys, 2 girls. A heavy sell to teenagers. The joy of a job well done. Absolutely knowing that you've done your best. And then analysing it, being brutally honest with yourself and working out how to do better tomorrow. And certainly in my space, I've been fortunate connecting with people along my career that have really facilitated me being the best I can be, and actually really teaching me lessons. Harold McComb, a plastic surgeon of world renown, when I came to Perth, was absolutely pivotal in really cementing in my mind the whole concept of learning from today to make tomorrow better, as a duty and as an honour. And so there I was at med school, I was doing research, and the people who were doing research at the time, and it was were the plastic and reconstructive surgeons. It was an exciting time, it still is. You know, we've got extreme makeover over here, but you've got an extreme rebuild, and that's where I sit. And so understanding the technology and the science that's brought to bear in that environment was where I started doing an anatomical dissections for the plastic surgeons whilst I was a med student in my spare time. And it opened my eyes. I got into this place called the operating theatre. We talk about multidisciplinary teamwork, but when you walk in an operating, I still remember this. I know what I was wearing that day, scrubs. I got thrown out otherwise. But there I was, walking in with eyes like saucers. Look at the anaesthetic machines, the microscopes, the suture with the polymer chemistry sorted out, so that it's swathed to a needle so that it could go through a 2mm vessel without snagging, without leaving a split, just that round hole. Had the capacity and the lack of memory so you could tie a knot to keep that blood vessel together. And then all the drugs and the nursing, all the allied health around, and just watching that surgeon change the life of that individual who was at their most vulnerable. I still find it a marvel, really, that someone will give me consent to operate. And I look after them when they are at their most vulnerable. It's something you can never take for granted. It's a relationship that is unique. The relationship between a doctor and a patient is unique. It puts you in a position of extreme power, I guess, in one way. But as you clearly see from where I'm coming from, it's obligation, it's duty, it's honour. You know, I have another fundamental belief. I thought this is probably lesson number 3. You get up in the morning to be the best you can be. Oh, yeah, I'm a bit tired today. Oh, right, can't be bothered. I suppose I've got a few cases to do, yeah. Oh, well, near enough's good enough. Average, yeah, I'm still average. Do nobody any favours. You bring your A game to the table. However you feel, you make sure, and I'll come back to this, that you look after yourself. Your health, your wellness, your education, your opportunities. But there's no substitute for bringing your A game to the table. It is what is expected of you, and it is essential. I was talking last night, we were just talking about how often people do things less than their best so that they don't upset people around them. Yeah? Oh, it'd be a bit embarrassing. How often do you do your very best and you watch somebody do their best and you bring them with you? You say, that's fantastic, can we do some more? Rather than walking away and shying away. I guess I learnt that coming from the place I came from. My mum and dad left school at 13 and 14, and they are focused on education to give us one thing, the choice to get up in the morning and enjoy what we did. And that's, you know, what I hope I certainly delivered to them, is the fact that, yeah, you did the job, because I get up in the morning and I enjoy what I do. You know, the 3 careers in a day. I see suffering. You know, people's lives changed in an instant. And see that suffering. I feel so strongly that one day we will be able to reduce that suffering just a little bit and tweak it here and tweak it there. And we can only do that by engaging in this thing called research. And that brings us to the science table. But it brings us so much more these days. So much more. I went into plastic surgery, as you know, and certainly very early into reconstructive surgery around burns, and working with people that were extraordinary in their selflessness. And I think it's really important to understand the things around and explore your own motivation. What inspires you? Think about it yourself. I think motivation is fascinating. It's personal, it's unique to the individual, but it's contagious. And then who inspires you? I've been very fortunate. I've been inspired by my parents, my family, by the teachers I've had, those people who've encouraged me along the way, but also the patients that you see, that you treat. And sometimes the things don't always go well. And I'd like to share with you the first patient in Western Australia who had skin cultured, and was cultured here in Monash by Joanne Padlaneski. And I was a registrar at the time, and it sort of illustrates that, in fact, you don't have to believe folks when we live in a hierarchy and we live in a certain structure, but there's always opportunity to ask, to connect, to rise to the challenge and connect with people that will facilitate. I was driving down from the kids' hospital to the adult hospital on a Saturday morning, and I heard Joanne on the radio saying that they'd been to Boston. It was 1990. They'd been to Boston, and they'd come back and they could grow skin cell sheets here. That means they could take part of the skin, split it, scrape away the sort of engine room, the dermal epidermal junction, and grow it into skin cell sheets. I almost crashed the car. I couldn't get to the hospital quick enough. We had a patient who was 56 years old with a 70% burn, and she'd been in the hospital for months and weakening as the waves of infection came over her, and she was weakening. And I ran in, I said, but we can do this, we can send the last piece of skin to Melbourne, and they can grow it in Melbourne, and she can heal. And everybody sort of shook their head. In retrospect now, they said that I just didn't hear them say no. And I went to the hospital administrator, the consultant in charge of the case, and consultant in charge of ICU. And I eventually got them to say, yeah, would you think it would work? I said, I have no idea. I spoke to the guys here. They said that they'd never grown skin so late after the injury. But I sounded so desperate, they didn't like to say no. So that's good. Always be a bit of desperation, yeah, bit of pressure. And so even Ansett Airways flew it to here for nothing, and flew Prof and Joanne back to Perth. It was probably the straw that broke the camel's back. There's not many of us in here that remember that Ansett was an airline here. And so we put the skin cell sheets on this lady, and it was a Thursday. It was now coming just after 5 months post. It took 3 weeks to grow. And she healed, and she got out of intensive care. She was in the rehabilitation phase on the burns unit when she had a cardiac arrest. And despite all our efforts, we were unsuccessful in resuscitation. On post-mortem, she had a mycetoma in the right atrium. She had fungus in her heart, from which she had no skin for so long. And I stood there, and you know, in this sort of time frame, I've tried to really impart in you this sort of the honour of doing this, and how good it is. But there will be days that are crushing, and this was probably one of my most crushing days, when I think of all the energy I had expended. And there are two ways you can go in those circumstances, I guess. One is walk away. And the other is understanding that however hard it is for you, it's a fraction compared to the people around that person, the people who love that person. And that's where I had to go next. I had to go and explain what had happened. I had to go and explain why this marvelous success had turned into a crushing failure. And so, what could I offer? I couldn't offer any hope for her anymore. All I had to offer was that I would learn from today to make tomorrow better. That other people would survive because of her, because we would never forget. We would not forget that experience. And the absolutely very obvious thing is the time to healing. If I'd heard that radio program at 5 days, 5 weeks, would it have been different? Absolutely, I know. The LD50 in Western Australia for burns is somewhere around 80-85%, where we expect 50% of our patients to survive that 80% burn. It has changed lives because it started us on a path that was focused on time to healing, focused on tissue regeneration, cell-based therapies. And so we were able to change the lives of others. But it doesn't stop there. It just gives you the opportunity to keep going because you meet people along the way. And I think as the team leader, you have to understand, you acknowledge people as the part of the journey. You're on a journey that will be different. Everybody's journey is personal. Everybody is their own journey. Acknowledge and thank people that are with you for the time. They will come, they will go, you will build, you will shrink. But in point of fact, that human energy is fundamental to what you're able to do. And with that in mind, I just wanted to really show you a few things, just really cementing the understanding how powerful it is to be a clinician scientist, because you're at that interface. You see that suffering, you see that the whole ramifications, the physical, functional, psychological ramification of this illness. And what are you going to do about it? In isolation? Yeah, you can do a lot, but together you can do so much more. And for me, bringing together the basic science, the clinical research translation and population health has been game-changing. As I'll just quickly show you this train of thought. N equals 1 should never be walked away from, and I fast forward now to 2003, a boy with an 80% body surface burn at 8 years old. We did the very best that could be done in the world at that point in time with various scaffolds and our cell-based therapies. We had him healed very quickly. He was paddling canoes and riding his horses. He was a country kid. 18 months later, his mum said, I think you did warn me that he may grow out of his scars and require reconstruction ongoing, as that happens in our big burns in the children. As I walked into the clinic, I saw the mass in his right upper abdomen. He had a hepatocellular carcinoma that had already metastasized to his sacrum at that point. He had no risk factors for it. He died as an 11-year-old. And the obvious question to me was, has that burn, or have we done something that has changed that life? Changed the risk analysis, changed the profile? N equals 1, you could have walked away from that. It's bad luck, coincidence. There's things that will snag in your brain. Your brains are primed to have things snag in them. Things that are at the back of your brain that itch and they stay there. This was an itch that stayed there, and it was the hope I could offer his parents. The only thing I can offer you is that I will never forget this. And that sometime, somewhere in the future, we will treat people better, differently, because of this. And so Western Australia is very powerful in data linkage, and it took me some nagging. They were harder to crack than Ansett, I tell you, the data linkage crew. But I eventually got the data linkage teams working with us, and we had an NH&MRC grant, and the answer to the question is yes, surviving a burn has an impact for life. But look at that, 96% of the children in this database of 30,000 people, and we matched them with 120,000 age, sex, geospatial, socioeconomic matched groups. And 84% of the adults were not major burns. That was a shock to us all. And it's been a shock to everyone across the world as we've started looking at things very differently. So if you survive, it influences your life. This is the Kaplan-Meier curve of children under 15 that are burnt before they're under 15, and the commonest age is toddlers. We have toddler scalds and adolescent bomb makers in our paediatric environment. And so you can see, could we actually prevent this? And what we realized, that it wasn't just that the deaths were accumulative. There was malignancies, it wasn't just skin, it was across the board. And it was infection, and it was all other things, particularly cardiovascular, raised its head very early, unmasked diseases of aging. So we had an animal model where we've got a 4% burn on the back of an animal model that we were testing the neurology of. And we looked at the heart and we found intraventricular hypertrophy. I don't know anything about intraventricular hypertrophy, but I know the people who do. And so I went to them and said, is this important? And they're in a huddle. Oh, it's clearly very important. That's good, right? And so they helped us do some work looking at the clinical situation. Our young men that are our slam dunk burns, these are the ones we expect to nail every time, in, out, 6 weeks, hardly any scarring. They're the ones that we've really made a big difference with. Yet they all had cardiovascular changes at 3 months. And so then we started looking way beyond into a whole raft of papers, whether you look at infection, musculoskeletal, neurology, gastrointestinal, mental health is shocking. Even when we take out everyone who's had mental health admission prior to their burn injury, there's a very significant increase after. Do I know anything about that? No, but I know who does. And so scar is abnormal in its architecture, its chemistry, its phenotype. What is going on here? It's linked us with immunologists. It's linked us with people who can understand this in a different way. So it's bringing the different teams together. And one of the teams that we've connected with is IBM Watson Drug Discovery Platform. This is a platform that actually ingested the whole of the world's medical literature. Oh, that's better than I am. So then you can interrogate it for a price. Yeah, I think that's a bit of a problem at the moment. But we managed to get in the back door, and we interrogated and got network maps where we put in burns and cancers, such that we saw where in the literature the pathways intersected, whether it's a genetic, whether it's proteins, different pathways, and then we're investigating these. And then some of these pathways, as I said, has taken us down the immunology route. But one of the things is you can't forget the basics. So in my space, every intervention from the point of injury will influence the scar worn for life. I am absolutely passionate about reducing that suffering. I know if we prevent, if we do first aid, right from the start, we can change that life. And that brings me, as I'm thinking to one of the times in my life where I did change enormously, it was an enormous change, was in 2005 as Australian of the Year. And I was asked a few questions around that time, and that were really significant. Not least of all would I be that person, and that was like overwhelming. And it's hard for me to describe because it's so different from everything else we do. Everything else you do the study, you get the exam, you get the choice, you do the paper, you knock back 3 times, but you dig deep and you grit your teeth and you go, I'm not stupid, I can get this back. And all these things you have to be resilient, and you keep standing back up. And then something like that happens, you think, whoa, where did that come from? And it gave me, I was asked, the 2 questions I will share with you, the one which I think is the funniest, was just as I was walking up the stairs in Parliament House, right in front, there were 30,000 people in front, it was Australia Day, and John Howard was going to give me a glass trophy. That was in my house. Mr. Nobody has broken it, so having a glass trophy was pretty dumb. But anyway, and as I was walking up the stairs, the guy who's organised the whole schmozzle, the whole Boxing Dice, goes, "You are Australian, aren't you?" And I looked at him, I was in my best frock, and it was a big day, and I looked at him and I said, "No, lad, does it matter?" And I thought I was going to be in a really embarrassing situation, because I hadn't been at a resus on my own for a very long time. And to be doing one publicly in front of 30,000 people would have been real, because he just went completely white. And so I was just kidding, I thought it was funny. And there he was, and he said, the backstory is that John Farnham came over here when he was 11, and his mum and dad never signed the papers, but there you go. But they did afterwards, when they found out they made him Australian. But the other thing, to serious note, was what is it that I wanted to share with Australia? And it sort of brings me to the beginning, as I've skipped a bit through my life. It's the decisions we all make, have a profound effect on each and every one of us. I think it's really important, the decisions you make about yourself, about your health, your wellness, your education, your ability to deliver, bringing your A-game to the table. All that is founded on making good decisions for yourself. But those decisions you make for yourself have a profound effect on our community. So and we have to take responsibility for that. So taking responsibility collectively as a community for our decisions is fundamentally important. And we have a health system that's one of the best in the world, but it's a runaway train. So how can we change that? We change that with people. We teach people prevention, for example, first aid. And this is when we teach people, I was asked to put my money where my mouth was, and if you do adequate first aid, clearly from this publication that's based on all Australasian data across Australia and New Zealand, it saves the health budget. Length of stay reduced by 21%, done, slam dunk. If you do cool the water here, my scarf, As a cup of coffee's gone down a child's chest, keep changing it, keep it cooling for 20 minutes. You reduce that wound by 80% in a paediatric scald, based on very solid science. You know, we've got to be in this space, because otherwise we'd be thinking, oh, should we put leeches on that scald? Or should we put butter, vinegar, toothpaste, egg, all of which I have seen, all of which don't do any much good. But clean, cool running water will actually reduce the scar, reduce the impact on that small child for life, a cost ratio in that circumstance of 1 to 20. So you can all change the health budget now, but we can change it much more by understanding now what it is that we're going to teach tomorrow. We have got some very fortunately funded by some very big corporate supporters. Chevron is one particularly that comes into my mind in that point when they said, oh, well, we'd like to fund your education program around. We said, well, we've done that to the point, but what I'd like you to fund is what is it that we're going to teach in 10 years, 20 years. That's what I'd like you to fund. And with Woodside, what I'd like to have a headset that has a capacity to see beyond the visual spectrum, so I can see the blood supply underneath. And I'd like to have real-time mass spec of the testing as the laser knife's going through, so I know what the quality of the cells are. That's what I'd like. Yeah? Pooh, and then I wake up. But anyway, but so we've got to actually be understanding that otherwise we'd be, not clean, cool running water, but toothpaste. And so I've spent most of my life in this space where we have changed the capacity to use cell-based therapies. So we harvest the cells, we no longer grow them in the lab, we deliver as a suspension. That's the story in itself. That's an Italian mouth freshener nozzle. But we had a lot of mouth freshener in the lab for a while. And then we've put the lab in a box and taken the box to the bedside such that we can do major burns, we can make a difference in pediatric burns, but we've only been able to do that by working together. So I think, as my life, I think clinical practice is the art of problem solving. But that's our starting point, that's what we are today. And I know that I make it clear that when I get up in the morning, I enjoy what I do in the main. It's not always easy. It's not always sunshine and roses. But because over the years we've invested in a team that has built and worked together, as I say, that expands and contracts, it's interdisciplinary, it's not a traditional allied health nursing medical. But on those days, the one thing you've got is people around you that are focused, like you, on making sure that we learn from today to make tomorrow better. And with that, I think we have to understand there is absolutely no space for anything other than bringing your A game to the table with integrity and a capacity to work, and linking with all those around you that far exceed the naysayers to make it happen. And then your resilience will build, and as a whole medical community, we will build, because then tomorrow will be much better. Thank you very much.